This is the Emergency Medical Minute, sponsored by Mile High Ambulance.
Hey EMM, it's Mason here to tell you about an exciting new opportunity we are offering. In an effort to tangibly improve our organization's commitment to equity, diversity, and inclusion, we created the Diversity and Inclusion Award that fourth-year medical students that identify as underrepresented in medicine and are applying to emergency medicine residencies are eligible to apply for starting today. We understand that the cost of applying to residency adds up, and we want to do what we can to ease that financial burden. We are extending 3 $200 awards to selected individuals following a blinded review of all applications. Applications will be accepted through the end of November, and winners will be announced mid-December. Check out our website at www.emergencymedicalminute.org/EDI-award for all the details and to access the free application, or click the link in our show notes. Thank you.
So we're going to talk briefly about a case of a neonate. This is going to be a 5-day-old who came to the emergency department with this visual diagnosis. So what do you guys see there?
I see syphilis.
I was gonna say earlier.
Or like gonorrhea, STI.
Yeah, something STI.
Okay. So, in medical terms, this is called Ophthalmia Neonatorum. So just ends up being a neonatal conjunctivitis. So a conjunctivitis that presents within the first 28 days of life. It ends up that there's a very characteristic presentation based on the timing. So if you present sort of 0 to 2 days, it's one category of infection. 2 to 4 or 2 to 5 days, it's another category of infection. And then 5 days to 1 month or 5 weeks is the third category. So I heard some people mention STI. Women, when they're pregnant, get screened for STIs. It ends up that infections like gonorrhea and chlamydia, which can cause neonatal conjunctivitis, get screened for. And when you look at the CDC guidelines, it's sort of arbitrary, women less than 25, and then women at quote unquote at risk. So there are categories. It's not a routine screening process, so these infections still exist. So it ends up that neonates still get eye drops, silver nitrate. That's prophylaxis for gonorrhea. It can cause a conjunctivitis, a chemical conjunctivitis, in the first 2 days of life. Okay, so that's that 0 to 2 category. 2 to 5, which is this presentation, is actually gonorrhea. And that's the one that's most dangerous, and it's actually something that you need to be admitted for. Vision threatening, also can cause sepsis in kids. So they get admitted for intramuscular or IV antibiotics, generally a third generation cephalosporin. And then the most common category, other than just sort of a benign chemical conjunctivitis, is chlamydia. So that's 5 days to 5 weeks. And notably, those kids can go home. They go home on erythromycin. So it ends up that this is, not that common, but a really important visual diagnosis to make. It's something that we've all come across at some point in our careers. So especially now that we're seeing the pediatric patients, there's an increased emphasis for us to sort of be aware of those conditions. Does anyone have any questions about that? Ophthalmia Neonatorum, neonatal conjunctivitis.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.